Well, just yesterday, my wife and I were cruising down Pacific Coast Highway. The beaches are closed here in California, but the line of cars went to the horizon for mile after mile, parked on the side of the road, not actually on the beach, just citizens sitting there getting a little bit of fresh air, 40-mile-an-hour breeze coming offshore, one guy out there parasailing, and, of course, the sheriff's waiting for him because he's spreading this disease throughout the course of the continent, and so on and so on and so on. Hi, everybody. I'm Bill Whittle here with Steve Green and Scott Ott, and I'd like to talk a little bit about the terrible mistake that we as the American people made 6 weeks ago. I'm not talking about the shelter in place or the quarantine. I believe that did save thousands of American lives, and I think they're worth saving. The mistake that we made, however, was that we didn't sign a contract with the government, and what I mean by that is we agreed to do something for the common good, but we didn't figure out at what point the common good would have been served. We didn't demand the information that we would have been entitled to. And guys, as we said in the backstage show, it's kind of like we hired somebody to put on an addition to our house. We just shook hands with a contractor and said, hey, we need an addition to the house. And he said, okay. And so we said, get going. And we didn't agree on a price. We didn't agree on a size. We didn't agree on a delivery date. We didn't agree on milestones. We didn't agree on anything. We just agreed that sooner or later there would be an addition to our house, and that's pretty much what we did during the pandemic. Steve, we'll start with you, I guess. What I mean by the fact that we didn't get a contract was that it is clear to me now, and I think it's clear to most Americans now, that the sacrifices that we made in the first 4 or 5 weeks of this pandemic not only flattened the curve, but cratered the curve, and that we were told that, well, we could basically go back to work when the number of cases started to decline. That happened 3-4 weeks ago. We were told any number of things, and we still wait to be told. We never, ever figured out what the end game was. And if we were going to agree to these intrusions on our liberty, which I maintain we did voluntarily, and I maintain we did very well, and I maintain it was worth the sacrifice in terms of American lives saved, nevertheless, we basically took the government at its word, not in terms of the lockdown, which I think was probably worth doing. That's up for discussion. But certainly we took them at their word when they said that we would be able to go back to work when the worst of this was over and when we had flattened the curve. Flatten the curve was the advertising slogan we were sold. Yes. And we cratered the curve. There are hospitals in California that are going out of business because they don't have any patients. So what I'm saying, Stephen, and what I want to get your take on it is why, not even so much why didn't we, but what would the end game look like? What would have been a reasonable exchange for our liberties in terms of, yes, we need you to do this now for the sake of your countrymen's lives, but when this, and this happens, then we start going back to work.
Yeah, the FDA, I can't remember whether it was created at the time or just given broad new powers over medical approval back in the 1960s after thalidomide, which is a problem mostly in Europe. I don't know if you remember what thalidomide was, but a horrible, horrible drug. And it was used very little in this country, thank goodness. And unfortunately, there are a lot of children of thalidomide in Europe who have horrible birth defects because of the use of this drug. And so the FDA was given all these broad new regulatory powers for approving new drugs. We had the best of intention. We didn't want happening in Europe happening here, just like we didn't want what was happening in Wuhan to happen here. And Americans started sheltering in place days and sometimes weeks before the orders came down. My wife and my kids and I have been sitting here at home for about 2 weeks before Governor Paulus made it mandatory in Colorado, and I really resent the fact that he made it mandatory. Damn it, we're doing the right thing. I don't think he's got that authority, or at least if he does, he shouldn't use it. We're supposed to be a free people. But to get back to my point, we did this with the best of intentions. We allowed government these broad powers with the best of intentions. But flash forward about 20 years after the FDA and thalidomide, and it's 1984, my father died of a blood clot while waiting for a heart transplant. Now, dying of blood clots is not uncommon for people in his bad condition. When your heart's that weak, your blood doesn't circulate correctly, you develop clots, a clot breaks loose, it gets in your heart falls apart. This is what happened to my dad. Fortunately, it's much less common today than it used to be back when my dad was waiting for his transplant, simply because we have better blood thinners. One of these better blood thinners, I can't remember which one it was apparently available and proven pretty effective, pretty safe, whatever. And my dad could have been on it. Maybe it would have helped him. We'll never know. But by the time a bureaucracy has had a particular power for any significant amount of time, it's less about the mission that was originally assigned to it, and more about bureaucratic ass covering. If a drug were to get out into the wild, so to speak, that the FDA had approved, and then it goes and kills somebody, then that's the headline. Guy dies of drug approved by FDA. Man injects bleach after Trump says something about disinfectant, right? That's always the headline. And so you have these governors across the nation with these lockdown orders who are desperately afraid that if they loosen these lockdowns, that one extra person is going to die, and that's going to be the headline. Not that Gretchen Whitmer is a proto-fascist who is harming the people of Michigan with her perverse shut-in orders, but that she loosened the restrictions and one extra person died. And we wouldn't have this problem. You know what? We would not have this problem if we had a media that was
correct,
any good at its job. The laziest stories in the world, Bill, and we've been seeing these lately a lot, is grim milestone. Nation reaches grim milestone as 50,000th death is recorded. Nation reaches grim milestone as COVID deaths exceed deaths in Vietnam, which what the hell kind of a measurement is that? It's the laziest fear-mongering kind of reporting you will ever see. It's what our media engages in. Instead of talking about things like a column I wrote last week for PJ Media about the election in Wisconsin. It was held on, I believe, April 7th.
That's right.
Yeah, the Democratic governor had tried to cancel this election or postpone it into the summer. The Republican Assembly and the Republican-dominated state Supreme Court said, no, we're going to carry on a schedule. And about 418,000 people in Wisconsin voted in person. So you've got almost 500,000 Wisconsinites gathered together at a limited number of polling places. You've got all these poll workers, and the surge in Wuhan flu infections was 52 people. And of those 52 people, an unknown number of people may have been infected before the election, and an unknown number of people may have been infected up to a week after the election. So the actual surge, number one, wasn't a blip, or was barely a blip. And that blip you can't even attribute to these 418,000 people getting together at the polls. So
there was no result. There was no statistical result of this.
Exactly. And it was maybe some of the worst conditions you could have had outside of a nursing home or a cruise ship, getting these 418,000 people together over a course of a few hours at a limited number of locations. So we're finding out what works and what doesn't work. But governors like Halfwit there in Michigan would much rather cover their asses from one bad headline from our craptaculent press than do the right thing by their own people.
Scott, you live in Texas, and I'm proud to have been there many times, and I'm very proud to have been given honorary membership in citizenship in Texas.
Nice.
And the reason I say that is because Texas went to work really kind of starting yesterday in full. You went back to your job. You have a retail job. And it sounded to me that the procedures in place were sensible and reasonable, like everything else that the American people have done pretty much on their own. I believe you said that your store would be limited to 25% of its total capacity, that the staff would continue to wear masks for the foreseeable future, and so on. This is the kind of sensible, phased kind of a recovery that, in my opinion, should have happened 3 weeks ago, once it was clear that the total number of cases were in fact declining. I'll get to my conclusion about this when I get to it, but I was very pleased to hear your report on what business was like yesterday. And do you feel that that Texas is a state that loves its economy more than its people, that you're death-worshipping, money-grubbing, mortality cult, or do you think that maybe this is a reasonable way to get back to work for people who don't have the luxury, like Bill Gates, of staying locked down until 2933 or whatever his particular fortune allows him?
You know, the thing about history is we only get to do it once. It would be fascinating if we could run a control group experiment and say that the government didn't give any directives at the county level, the state level, or the federal level, but merely provided information. And said, you know, because of our ability to aggregate data, we can tell you here's what's going on. Here's the track of this virus. Here are where the hot spots are. This is, and as I think one of you or both of you have pointed out before, I get a daily thing in my news feed among all the other stuff that says how many new cases there were in Denton County. I live in Denton County. What it never does in the headline is say, I don't even know how many people live in Denton County. Of 250,000 people in Denton County, there were 17 new cases yesterday or whatever. There's never the side-by-side comparison of how does this fit in context. So it just sounds like, more. There's more new cases. So what would have happened if the governor had just said, you know what? Here's the information we have. Here's how we're trying to make sure that we coordinate among our medical facilities, hospitals, doctors, paramedics, and all that, so that we are able to respond if there are concentrations of infection and things like that. We're going to trust the people to use your best judgment. If you operate a business and you can continue to do so with, precautions that you think will ensure the safety of yourself, your employees, and your customers, we're not going to interfere with that. It would have been fascinating to see what had happened if we had done that. Now, the fly in that ointment is, as people will point out, and they say, well, if the government doesn't get involved in that, then people have this fraught relationship with their employer, because the employer may say, you know what? We're continuing to keep the store open and you'll be working 40 hours this week. And the individual may say, I don't feel comfortable doing that. I feel, like I'm vulnerable to this condition, and I don't want to subject myself to it. I'd rather stay at home. At which point, without a government mandate, the employer could say, well, I'm sorry, we're going to have to let you go because we need people here to staff the store or the factory or whatever it is. And so that's always the argument against it. I don't know if there's a way to thread that needle that satisfies everybody, but I think the lighter the hand of government, the better off we are. As Steve pointed out, there were people who were already sheltering in place, so-called, before the government ever said to do so. Our store was allowed to stay open. We were considered a provider of essential services. We provide a lot of things, but we were considered to be essential, and we could have stayed open. But the people operating the store decided that it wouldn't be prudent to do so for health and safety reasons, and frankly, because the traffic to the store dropped off precipitously as more cases began to be reported. I tend to think that people, not everybody, but the collective judgment of people tends to be pretty wise. And if we had run this again and tried this experiment one more time and did it with a lighter hand of government or no hand of government telling us what to do, I'm not sure that we would have come up with different results. I think people are smart about their own health, about their own businesses, about frankly, the risk of having a business that's open and you have 80 people show up with a virus and some of those die. So I don't know, Bill. I think we could have done okay without it, but I'm not one of those, by the way, who posits that there are some sort of, people in government who just went, oh, a virus. This is an opportunity for us to impose our fascist rule. I really don't think politicians are really that organized.
Well, the main question, of course, is the entire point of the episode is, we agreed to the lockdown, and what was the end game? What conditions had to be met in order to go back to work? It is the opinion of many doctors, and I'm not going to single out Dr. Fauci, but all epidemiologists are concerned with minimizing deaths. And if they say we stay home until July 2022, That's their job. That's just not reasonable. Everybody knows it's not reasonable. So where is the metric? And this is my point. There was never a metric other than the one that was sold to all of us and the one that we all reacted to, which was flatten the curve. Flatten the curve, let's just go over it one more time, means that instead of a sharp peak where you exceed the ability of the healthcare system to deal with it, now you got people who are in car accidents who can't get treatment. They're dying in the sidewalks outside the hospitals because the hospitals are flooded. Flatten the curve means keep it underneath the ability of the healthcare system to deal with. We have done that. Ideally, it should have been pretty nearly right at the curve. That's the quickest way to get everybody back to work. We haven't done that either. We have been told that we would go back to work when the number of cases decreased. That was 3 weeks ago. They never peaked as high as they were going to. So let me just make this perfectly clear. I am not one of those people who is a Monday morning quarterback. I think 2020 hindsight criticism is a cheap thing to do. It's easy to look back and say, should have done this, could have done this. I'm not doing that at all. I am willing to say that everything up until the point where the cases started to decline were done in the best possible motives, and we're just a bunch of people working. The initial models were grossly overestimating the number of deaths, but we didn't know that until the number of deaths started to actually happen. If you've got a worst case scenario, that's what people need to know. I don't fault them for that. I don't fault the governors for locking people down when they're told that if you don't do this, there's going to be 200,000 or 2 million dead Americans. I don't fault them for that either. None of that is stuff that we didn't know. But what I do fault them for and continue to fault them for and fault them for more every single day is the lack of response to the actual on-the-ground data. In other words, we were told that the science tells us that we need to shelter at home. Fair enough. There's certainly an argument to be made for that. We did that. We saved an awful lot of lives. Now the science is telling us that at least in places like Kern County, hospitals are sending doctors home because there's not enough work for them. That's not a model. That's data. That's hard data. We're hearing stories from around the country. People get a broken arm or a broken shoulder. They go to the emergency room. There's no one there. That's data. And the thing that is the biggest lie of all is that we were never, ever told, and we continue not to be told, that somehow if we wait long enough, none of us will get infected. That was not what flattening the curve means. The second that it was clear that we were not reaching anything like the number of cases that we expected to reach and reaching that saturation of our medical system, that was the time when we should have started letting people go back to work in the manner that Scott's described, where it's okay, we're going to go to 25% capacity and we'll do this and so on and so on and so on. I'll just close this by telling you how I feel. And I know there are people out there who are saying this from the beginning. And if you're saying this from the beginning, great, you might have been wrong. We just didn't know until we know. But I'll tell you how I feel now. Now I feel like a chump. That's how I feel. I feel like a chump now. I feel like I made an agreement to do something that was clearly to me in the best interest of me, my family, and my countrymen. And I voluntarily went and took an enormous amount of damage, not nearly as much as many, many other people in this country. And I did it out of good faith with the understanding that this was a national emergency. And as these numbers continue to fall, and as the number of hospital beds and as are not needed, and as USNS Comfort sails out of New York Harbor after barely being used, every single day that goes by with this kind of response, I feel more and more like a chump and a sucker for having taken the government at its word that this was an emergency and that we would deal with it based on the science. When these numbers of cases did not materialize, what we should have done and would have done if we'd had a half-decent media is we would have said, my God, these measures that we have taken have been so much more successful than we could have possibly wildest dreams hoped for. We have done it. Congratulations, America. Now let's go out there slowly. We are going to get infected. That was never, ever, ever, ever on the table that we wouldn't. It is a novel virus invented by China. There is no immunity to it. And there was never, ever a case where we would be able to avoid it. It was just, can we get it over time? Well, we did. And still we stay locked up. And still we have no metric at which point we can say this is the best that we can do. I am really angry about this, and I'm getting more angry about it every day, and I suspect I'm not the only one. as with all Americans who volunteered to do this for our countrymen, and for the sake of the lives of the people in this country who are not expendable and who not need to be thrown away because they're no longer economically useful or any of that horror that we fight against. Every day that goes by now, I feel more and more and more taken advantage of. I feel more and more that my patriotism and my willingness to voluntarily sacrifice for my countrymen is being taken advantage of by power-hungry people who are determined to hang on to this for as long as they see fit. And so we had better have some pretty quick answers in terms of what constitutes success in bending the curve. And I'd be willing to bet you that for virtually every state in the union, with the possible exception of New York, those conditions occurred 3 weeks ago. And every day that goes by since then is another day that I feel more and more like my trust was violated. And some people are saying, well, we could have told you that in the beginning. Well, turns out you were right. Turns out you were right. Could have gone the other way, but it didn't. Yep, you were right. Those people said, can't trust the government to do this. Turns out, yes, I believe now that you were right. We continue to stay here. We continue to stay here. We're not given any date when this is going to change, at least not in California. Thank God for Texas. And by the way, folks, just so you know, in about another 3 or 4 or 5 days, the first numbers of cases are going to start to increase in Texas. This is what is expected. This is what is inevitable. This is what was always supposed to happen. And as Steve and Scott both pointed out, the shrieking will begin that these people's blood is on the hands of the Texas governor or on the president or whoever else by a media that is absolutely complicit in this tyranny and has been the absolute catastrophe of the entire pandemic. When this is over and we come back, we will have a healthier country. I've always felt that. We'll have a better idea how to deal with pandemics. We'll have a much better idea about how to deal with China. We'll know that the news media is the enemy of the American people, and we will no longer be willing to willingly agree with the government without an ironclad contract and metrics on the other side of this kind of thing because of the abuse that they continue to pile on us in a state where I live, where the hospitals are empty, and people still can't go out on the beach in a 40-mile-an-hour wind because Lord Newsom has decided that it's not safe to do so. Time is running out on you folks. And distrust of the government is increasing every day all across the spectrum. And if you people in power think that you're getting stronger with this, you're not. Your position as governors and mayors and administrators gets weaker every single day. And if I were you, I'd get out of the way of the American people while you still have a chance to do so voluntarily. For Steve Green and Scott Ott, I'm Bill Whittle. This show's made possible by the members at BillWhittle.com. We'd love to have you join us if you'd like to. We'll see you next week right here on Right Angle.